I just wanted to hop on really quick and talk about something that that I have to do at work, that I actually like to do. So one of the things that is tasked with me or with us as leaders is to do leadership rounds on your staff and the patients. And I always have liked the idea of it, and I do think it's valuable. However, one of the things is that you have to ask specific questions. They assign the questions to you. And that made doing the rounding really hard for me. So the feedback was pretty consistent across the board that made it challenging for people, because when you're out, you kind of want to let it be a little bit more authentic, I think, than allowing a set of questions decide how you communicate with the patients that you serve and the staff. So I decided I would just kind of wing it a little bit and just see, and either state that I didn't ask the question or answer it kind of vaguely if it didn't allow me to, because some of them are like required. And we did ask specifically as a group, like, do we have to specifically do this? And they said no. So this week, when I kind of went around, one of the questions I asked, instead of getting into all the things like, what does HRO mean to you? I think HRO is very important. I think that for HRO to really work, trying to get the frontline staff to be aware of like, what is the current theme, is not one of their top priorities. And that isn't a bad thing necessarily. I just think that when we're asking questions to frontline staff or to the people that are veteran facing or patient facing, we need to remember what matters to them, or at least that's my perspective. So one of the questions I decided to ask this week was, what is it that leadership or that I could do in my realm that would help offload you in some way? What is something that like annoys you all the time and you would just like fixed? So I decided to kind of like shift that a little to see, are the things that I'm doing actually making an impact, or do I think what I'm doing is really important? And it might be in the grand scheme of things, yes, but does it matter, and does it help us deliver care better and more effectively? So I just kind of has been thinking about that, and I worry that sometimes we think we're doing a good job and we're making a difference, but maybe we're not. Maybe we're wrapped up in our, and I hate to say this, I'm so sorry, I know people are going to be mad at me, but like the idea of like, oh, you're just admin now. Like, I know a lot of us try really hard not to do that, but at the same time, do we just do it naturally after time? Are we thinking like, what makes their job hard? What can I do to make it better? Not what can we do to fix our numbers? I think those are the questions we get asked. Those are our tasks. Like, how do we fix our numbers? Those are our tasks. And yes, our frontline staff have to carry them out. But how can we support them in doing so that not only are they happy, but the veterans are also happy? Anyways, those are just some of my thoughts. It's a little longer than I had intended. I'm sorry, but I don't know. Do you guys think like that? Am I like weird? I don't know. I can't decide. Let me know.